Back, you're watching The Globe on the SABC News Channel. Transgender adolescents are at higher risk for violence, victimization, suicide risk than their cisgender peers. This despite growing global attention on acknowledgement of gender diversity. Almost 1 in 10 teenage deaths in South Africa is a result of suicide. And the risk is even greater amongst transgender youth who don't receive the support that they need. According to researchers, gay, lesbian and bisexual adults were at least 50% more likely to commit suicide at some point in their lives compared to heterosexuals. Bullying, discrimination and misinformation have been the leading contributing factors in suicides, as many face an uphill battle for acceptance. Transgender youth are more likely to have a history of mental health problems such as anxiety, depression and substance abuse. Suicide is the second leading cause of death amongst young people between the ages of 10 and 34 globally. Well, people identifying as transgender is, however, not a new phenomenon. According to Psychiatrist, Prof Gerhard Grobler, gender non-conforming people have been documented in the histories of cultures across the globe, including in Africa. For more on this, we're now joined via Zoom by Professor Grobler, the past president of the South African Society of Psychiatrists. Thanks very much indeed for joining us, and welcome to the program.
Thank you for the opportunity, Peter, and for the chance to speak on behalf of the South African Society of Psychiatrists.
So, mental health is a big subject, and often we speak about it and we like to put categories, depression, etc., etc. But it does seem that there are some people in these subgroups, transgender, who may be falling through the cracks because their subgroup isn't seen as an increased higher risk grouping.
Indeed so, and I think the opportunity to bring this to the fore is quite valuable, and thank you for that again. So I think it is correct in saying that we want to say from the outset on behalf of the of SASOB, we don't consider somebody identifying as transgender or being transgender as having a mental illness per se. But as you've indicated, people identifying as transgender may have a higher risk of mood disorders, anxiety disorders, including then suicide risk, as you've indicated. And mostly that is because of the factors such as bullying, harassment, including sexual harassments, factors like corrective rape leading to post-traumatic stress disorder, substance use disorders, and so forth. And so it's important for us as a community to talk about this and to bring it into the open so that we can offer our support to those of the trans community who needs that.
I would imagine, these things start quite young when you realize, A, that the church that your family goes to doesn't approve, that society, the culture that you belong to doesn't approve. All of these messages quickly keep coming to you from a very young age, even before you've been sexualized. And when you start to find your sexual identity, I guess that's where the first anxieties start to set in, where you know that society doesn't approve of this, your culture doesn't approve of this, family doesn't approve of this, and that starts the build-up.
As you've correctly indicated, the awareness of being gender non-conforming or being different from your peers could occur even pre-pubescent and even in younger children. But it is a part of a developmental process, and as a person's identity develops over time through different phases, also the idea around your gender and sexual identity. And so we see people identifying as transgender manifest with different concerns at different times in their life, but certainly around adolescence, when hormonal changes come into play, it becomes more acutely to the fore, and that is when people often come and say, I need some help and I need to make a change in my life.
What kind of conversations need to be happening at that vulnerable time to stop this desperation that then sets in much later on?
Well, I think one of the biggest misconceptions that parents often have or teachers have is that this is a passing phase, this is just a child that's maybe playing up, or, that they're not serious about this. And I think it's that not accepting this as a part of the person's development and something that's very important to them that often leads to problems. So one of the conversations that parents and teachers can have is to really listen to the child's experience of what we now call gender dysphoria, the unease with the incongruence between their lived experience, the way that they identify themselves, and the gender that's assigned to them at birth. And so I think that conversation is much more listening and supporting than it is giving advice and doing something.
I guess for some of us who never had to think about these things, give us an understanding of what causes this. I think you used a clever word just now, dysphoria, what was it?
Dysphoria.
Yes,
Gender
yes.
dysphoria.
What causes this?
Well, I think that is very much still open for debate. There are some indications that biology plays a part in this, but certainly societal values and societal ideas also play into this. And so very often the dysphoria that members of the transgender community experience does not stem from them being transgender, but it stems from the reaction and the comments made to them by members of the community and even their own families. So the dysphoria is a reaction to the community's response on them rather than their experience of being transgender.
I suppose that there must be some transgender people who don't want to be transgender and sort of battle with that in itself. It becomes a thing of, I want to be accepted by my family desperately, I want to be accepted by my culture, I don't want to be this person, and that must cause some anxiety.
I would not presume to speak on behalf of any member of the transgender community, but what I can say in response to your comment is that there's certainly a variety of responses amongst people of the transgender community that I've dealt with, and some of them really embrace their identity and want to live it out, and the concern is that the family don't accept that, and there are others that, as you've described, struggle a bit more. I think it's part of any developmental process, of really getting to know yourself and where you fit in the world and what life you want to live. And that I don't think is only true of members of the transgender community per se.
Yeah, you're so right. So, as a psychiatric professional, what kind of interventions do you then get involved in? What are you trying to do when transgender people approach you? What are they dealing with the most?
There are multiple layers to transitioning, if we can start there. And so part of that would be the social transitioning. Often that has to do with changing a name to better reflect the gender the person identifies with, changing pronouns, and maybe that can link also to our previous conversation of what families and parents can do, and that is to respect and to honor the use of the pronouns that the person prefers. That's part of a social transition. And then from the more biomedical side, there would be the psychological, psychiatric intervention, just to emphasize that identifying as transgender in itself is not a mental illness. But it could be associated with a whole variety of symptoms, as we've previously mentioned. And so often I would get involved in treatment of the mood disorder, or anxiety disorder, or post-traumatic stress disorder. And then part of that process would be using hormone treatment to feminize or masculinize the person according to their preference. And then if they so choose, they might have the option of gender-affirming surgeries.
And I would imagine by the time they've gotten to a point where they start the process, a lot has happened to get to that decision, and that's probably when they need the most support.
Quite so, and I've certainly dealt with people who had a lot of support from their loved ones, from their partners, from the community that they come from, and you know, they don't need a lot of support from my side. But it's also true that there are a large number of members of the transgender community who do not get that support, and for them there are psychological and psychiatric services available to support them.
I think when we started this conversation, we were looking at young people as being the most vulnerable. And I think you started to explain that it's partly because of that's the time where we start to see ourselves sexually and understanding our sexuality. Is that perhaps why it correlates with this number of suicides and extreme depression that we see in that age group?
I think indeed that's the case, and if I can quote E. Cummings, who said, it's a difficult thing to grow up and to become the person that you're meant to be. And so particularly around the adolescence and the teenage time, it is a time of change, a time of growth, and you know, that's always a difficult period in a young person's life. And on top of that, if you're not supported or you are ostracized or bullied, it becomes even more difficult.
What can parents do? What are the signs that, you know, perhaps my son, my daughter is going through something, but, you know, there's some subjects that parents really find difficult to talk about, and I suspect that this is one of them. How can we help them? What should they be doing?
Well, as we've said in the press statement that we released, we would like to encourage parents to support their children and to really listen to them and to give them the opportunity to grow into the person that he or she should be. And so that also means that parents often have to stand up for their children, be activists on behalf of their children at places like schools or other community structures where parents could intervene on behalf of their children. And so I think really to be on the side of your child, to accept your child for who he or she is or wanting to become, that I think is the most important thing that parents can do.
And teachers in schools, I mean, we've seen shocking videos recently of bullying, and that's just kids being kids. But unfortunately, when you have this extra layer of vulnerability, I suppose you just become an easier target.
Yeah, indeed so. I think that is very true. And I think schools have a responsibility to also intervene there and to set the boundaries quite firmly, that nobody should be bullied.
All right. Perhaps as a final message then that you want to put out there to communities at large?
Well, I think, Peter, if I might end off with a bit of a philosophical note, you know, the best thing that we can do as a community is to just follow the golden rule, to say, do to other people that you would like them to do to you, and don't do to other people that you don't want them to do unto you. And if we can do that, then maybe we'll have a more peaceful and inclusive community.
And that's a great place to end this conversation. Thank you so much indeed for joining us and talking to us about a very, very important issue. I think sometimes that we don't have enough conversations about. But thank you so much for your time and your insights tonight.
Thank you for the opportunity. Good night.